what is the prevalence, i.e., the number of people that get long COVID after acute infection? Why the controversy around this ranging from 7% of infected people to 60%?
So, kind of thing I was alluding to, it's just for all the obvious reasons, it's hard to count. Um, and, of course, I understand people's, cynicism and reticence and caution. And like all things COVID, we're all so, COVID exhausted. And I don't mean that in a biological sense. I mean that in a sort of political and psychological sense. And wherever we fall on that kind of political spectrum of libertarian or authoritarian or COVID skeptic or COVID phobic, we count the number, or we look at the numbers differently, don't we? So all I try and do as a scientist is look at the sort of meta-analyses, the analysis of the analysis, and say, what does it really look like is happening? So the first thing I'd say is that the skeptics and the long COVID deniers would try and say, well, you can't really trust any of the numbers because lots of the numbers are self-reported and come from things like questionnaires about people's health. And all I can say to that is that most of the people on planet Earth who've had COVID, and certainly most of the people on planet Earth who've had long COVID, haven't had access to a clinician to do detailed lung function tests or neurocognitive tests, and didn't have the opportunity of having a face-to-face appointment with a doctor to confirm their long COVID. But I think the long COVID questionnaires that are routinely used are very detailed, and sure, there's a kind of subjective edge to to life, isn't there? Where you get out of bed on a Monday morning and you think, wow, I'm not feeling quite as bright as I was on Saturday morning, and I'm taking those stairs more, slower than I did at the weekend, and I'm exhausted. But we're not talking about that. We're talking about objectively reportable differences
Mm.
in, my God, I can't stay awake for a working day anymore. I can't ride my bicycle anymore. I can't climb to the top of the stairs without wheezing and puffing and feeling breathless and like I can't cope. I can't stand up in the lecture theatre anymore. For a full half, 45 minutes lecture. Because I feel like I'm going to collapse. Real deteriorations and changes to people's health. So, we can sort of bicker about the numbers and how we come to the numbers, but I feel very kind of calm in my estimate that if you take the number as a kind of consensus middle figure of about 10% from those early I suppose 2020 cases, 2020 cases before the vaccine age, and 4 or 5% from the post-vaccine period, you wouldn't be far wrong.